So now I have great pleasure in introducing, we're going to have the panel now, but Dr. Anne-marie Boxall, Professor Sue Burney, and Associate Professor Vinicius Cavalieri will actually be saying a few words about their work and the strategies and initiatives that they've rolled out or tried to in their workplace that have really made a difference in the research environment. So Dr. Anne-marie Boxall, and I hope you all know Anne-marie because she's the Australian Government's Chief Allied Health Officer. She trained as a physiotherapist or was educated as a physiotherapist and has worked in the public and private sectors. For more than a decade, Dr. Boxall has worked in high-level policy roles in the Australian Public Service and for non-government organisations. Her role as Chief Allied Health Officer includes supporting the Australian Government's primary healthcare 10-year plan and workforce reforms. And please know that Anne-marie is our first ever full-time Chief Allied Health Officer. So she's much respected and very valued and very welcome. So Anne-marie.
Thank you very much, Kathy. And I'm not sure if I'm visible because I'm completely blacked out on my screen, but I do have my video on.
Okay.
It's possibly my iPad, which is old, and I'm not quite sure what I can do. So maybe I should just proceed, Kathy, because...
Yeah, just proceed. If you don't have any slides and things, then go for it. Just proceed.
Yeah. Okay, great. I don't have any slides, so I'm sorry that no one can see me. This randomly happens with my iPad. So look, again, thank you very much for the opportunity to speak with this group today. I will just address you can't be a researcher without drinking coffee, because I am still an active researcher and I don't drink coffee. However, I do drink a lot of tea. So I think that kind of covers the bill there. So look, what I wanted to talk to you today about was how allied health clinicians and researchers can influence national health policy. So my role in the Commonwealth Government it's a fantastic role, but it is very different from, I think, what most people are doing. But I did really want to take this opportunity to encourage people to think about how their research and their clinical practice can have an influence at the national level. The beauty about working at the national level is when you make a change, you affect a large number of Australians. So you can have a huge impact. The challenge is that it's much harder to do. But I just wanted to sort of put that challenge on the table and encourage people. So just a few, I guess, pieces of advice for people that are interested in influencing national health policy. So the very first thing I say to people is you need to follow the national health policy debates and the agenda. So that sounds simple, but it's probably a little bit harder than you think. So at the moment, we're obviously in the middle of an election campaign and there are a lot of discussions going on, some of which are about health policy. And so that's a great opportunity to follow the debate. But when we're out of an election campaign, things like subscribing to the Minister of Health's press releases. So that gives you a really good idea of what matters to the government and what matters in health. There are a lot of communications that come out from the Commonwealth Department of Health, and that's another great way of finding out what the agenda is. And the reason I really sort of focus on this is that if you are trying to pitch a policy idea or a reform or the value of your research to federal policymakers, that includes politicians and government officials, timing is everything and the framing is everything. So you need to know when to pitch your research to them. So things like if you've got a great idea that you think should be funded, first of all, you should find out when the budget cycle is, because that's where most great ideas are funded. And the budget generally happens at the beginning of May, but the work on budget happens from pretty much the December beforehand. So if you suddenly think, oh, gee, I've got this great idea, I think the federal government should fund this, and you come to the minister or the department in April, it's generally too late. So that is really important, and trying to pitch what you are doing or what you're working on, or what you want the government to think about in light of what they are already doing. So, for example, the government might be very focused on providing mental health services or supports through a particular program. You might have some research which is really relevant to that. So tell them how it could improve the program that it's already running. So it's trying to make it as easy as possible for government to see how it is relevant to them. Some other really sort of key things to know about the cycle of business is things like Senate committees and inquiries. They produce a lot of really, really in-depth reports on a lot of health policy topics. So if you follow the process, find out when they're calling for submissions, and you've got research that's relevant, you should make a submission. Anyone can do that. You should also find out when those reports are being released or tabled in Parliament, because that's another opportunity to highlight the research that you're doing or the work that you're doing or the clinical practice you're doing. So these kind of routine things, just become familiar with them so that you know when is the right time. The other really important point is to find out what the federal government is responsible for. A lot of the information that we receive, or people come to us with good ideas, is probably done by the states and territories. And so it's sometimes hard to know from the outside, sometimes hard to know from the inside, to be honest. But find out, ask. And so is that what I'm working on, is this something that the federal government can influence or be interested in? If not, you can contact the states and territories about the same sort of thing. So it's just make sure you're talking to the right person. The other tip that I had for people too that are trying to influence national policy is to work through organisations that already get access to ministers and to government officials. So we are engaged with lots of different groups all the time, routinely, and they have a voice at the table, they have a seat at the table, they have a voice, they are listened to, they are heard. So it is hard for individuals to sort of get their foot in the door. So my advice is to find out who already has their foot in the door and talk to them. So, for example, on allied health, we very routinely engage with a whole range of allied health peak bodies. And so if you have research that you think is interesting, make sure you tell them about it and make sure you're involved in their processes, because we often go to them and they would then be able to say, oh, actually, we do know something about that. You know, this person's doing this fantastic program, or we found this really great research, you should know about it. So that's a really easy way to get in front of policymakers. The other one is to engage medical peaks. So again, your research may be about allied health, but there are a lot of medical peak bodies that are interested in the health system and health services more generally. And they will sometimes recognise how important allied health is as part of that team. So sometimes it's worth going beyond the allied health sector as well to try and have some influence. There are also a lot of peak bodies or non-government organisations that look at specific issues. So, for example, the National Rural Health Alliance looks at rural health, or the Obesity Coalition looks at preventive health. So a lot of those organisations would really appreciate contact from clinicians and researchers that have suggestions or ideas about how they could improve outcomes for people or improve health services as well. Another great idea is to work with research academics in allied health, so the conjoint professors in allied health, because they do have a seat at the table at the main, I guess, stakeholder meetings that we have on allied health. And we do go to them seeking information and research on best practice in a whole range of areas. And then finally, it's a great idea if your research is relevant to aged care or disability providers to go through them as well, because they also are routinely consulted by governments and their ideas are sought. So there's a few ideas about who you can work with. And then finally, if you do have some really fantastic groundbreaking research that you think is relevant to the federal government, the minister or the department, then contact us directly. There's no rule saying you can't. You absolutely can. But a few key tips for how you should do that. First of all, write something that's really short. And I know that is a challenge, but no more than 2 pages, and explaining what the problem is and what problem you are solving for government. So government are very interested in solving practical problems. They're not so interested in sort of theoretical issues or understanding the extent of the problem further. They want to know what they can do about it. So my advice is explain what the problem is and what the problem is for government. It might be that this costs a lot for government. It might be that there's people missing out on care. It might be that this is going to be a future problem for government if they don't do something now. So simple things like that. But also explain to government what they would need to change and be precise about it. So look at this research and they need to make changes to this program or this funding or this policy, and this is how. It doesn't have to be detailed. Details can be worked out later, but they need to know which lever they need to pull or push in order to make a change. The other thing that's really critical is to have a go at estimating what it might cost. And that means both in financial terms, but also in political terms. So you might have some research and say, we absolutely need to do X, Y, and Z, but it's going to be a huge controversy with all of these other groups in the community. They need to know that. Doesn't mean they won't do it, but they need to know what political battles they might be getting into. And they need to know if this is going to cost $10 million or $10 billion. It's quite different, obviously. So give them some kind of information. The other things I would really suggest is, if you have got some research that you think is highly relevant, is to seek a meeting with the minister, the relevant minister or government officials. They are really interested in good ideas and better practice. They just need to know why it's relevant to them. And the other sort of less direct route is to try and get media coverage for your research. So things like, writing to the local media, getting radio and television coverage once you've finished research, or writing for the conversation, which is often leads to media coverage in its own right. And it's a great discipline, writing up your research for something like the conversation. And then finally, I just wanted to point out another opportunity to influence policymakers and make a difference is to do some training on the policymaking process and research translation, but also see if you can get some experience. So one of the things we've been doing in the Department of Health is running short-term secondment for academics, so allied health academics, to come to the department and work with us. We've done 2 so far, and they've both been a rip-roaring success. So we got lots of really great information about research in allied health that was directly relevant to what we were working on, so aged care and primary care. The researchers themselves got a huge amount out of it, understanding how government works and how they need to pitch their research to governments. And we've got these ongoing relationships now where we can say, hey, can you just give us the best information you've got on X, Y, or Z? So it's a really great to take a chance on doing those kind of things. It could be a short-term secondment. It could be a short-term job for 3 months or 6 months, or it could be permanent, but I don't want to recruit all the allied health to the department. But there are lots of ways you can find out how it works in a really productive way for both you and the government as well. So I'll leave it there, and thank you, Kathy, and I'm sorry you can't see me.
Yeah, I'm really sorry. That was awesome. Thank you, Anne-Marie. Heaps and heaps of tips. I feel like we really need a whole workshop from you, but there's so much that was very rich in the how-to from the complicated to some very simple things, and very welcoming. So take up Anne-Marie on her offer, like for internships and things like that. Be really productive for all of us if more people did that. Thank you, Anne-Marie.